I'm Tricia Rodriguez. I am a principal applied scientist at Truveta. We're very excited that we just had a publication come out in JAMA Internal Medicine. This was the first comparative effectiveness study comparing tirzepatide and semaglutide labeled for type 2 diabetes, but to look at outcomes of weight change in overweight and obese populations with and without type 2 diabetes. Over 70% of US adults have overweight or obesity, so these medications have the potential to be used in huge numbers, and yet we don't have a ton of information on how well they work in real-world populations with and without type 2 diabetes. Truveta Data was really critical here. The reason that we were able to do this study on medications that were relatively recently approved was because we have access to timely information. It's also really critical. Truveta Data enabled this study by having a large and generalizable population. We were able to include a lot of patients that were not eligible for clinical trials. A lot of these measures that we looked at as outcomes, they just don't exist in a lot of other data sources. It might have been possible to look at this within one single health system, but certainly not a large and diverse population across the United States. It also would have taken a really long time to accrue a sufficient amount of data to really look at these outcomes for a big enough population. So this work would have been very difficult, I think, without access to Truveta data.